Welcome to Division of Aging Services. You have selected Senior Hunger Overview.
Greetings, everyone. My name is Temitope Ayejeron Walker, and I am Georgia's Senior Hunger Nutrition Coordinator. Today, I'm going to tell you very briefly about Georgia Senior Hunger Initiative. Let's get started. The overall mission of the Department of Human Services is stronger families for a stronger Georgia. The main guiding document for the work that we do with the Senior Hunger Initiative is Georgia's State Plan to Address Senior Hunger. The state plan was implemented in December of 2017, and I invite you to come take a look at it at aging.georgia.gov. You can see the rest on the screen. And of course, once you've taken a look, I would invite you to email us at senior.hunger@dhs.ga.gov. So there are 5 focus areas within the state plan. The first is today's seniors. We recognize that the diversity of seniors in the state of Georgia, whether they're a grandparent raising grandchildren or they live alone, own a home or rent, that with all of their needs and diversity of what makes them a senior today may mean that a Monday through Friday model for the services that we deliver at the state may not be enough. Meeting the needs of the community is really about what are ways that we can share and pool resources. The other part of this is also building up partnerships with faith-based entities, because we know that seniors are engaged with faith-based entities within the community, and the faith-based entities are great resources to get resources in the community. Another partnership that's critical is working with schools, either K through 12, because they serve students, and in the same capacity they can serve the seniors in the community as well, with proper care, resourcing, and staffing. The other part is looking at colleges and universities, whether they're doing research, encouraging that to be seniors, a great source to increase our workforce when we're looking at having students go out into the world and what areas they want to focus on. And of course, where colleges and universities have programming, we want to make sure that seniors are in that discussion as well. The next focus area is food access. The great summary of that is, how do we get seniors to food and food to seniors? So we're talking, of course, about transportation. We're talking about reducing food deserts, and a big one, knowing that anywhere from 30 to 40% of eligible older adults do not participate in the SNAP program. How do we close that gap? The next focus area is food waste and reclamation. We want to make sure that the policy is clear about the rules regarding sharing food, about food safety, and at the same vein, helping to improve outreach with a lot of the food collection agencies that are out there, while enhancing our partnerships with those food resource organizations. And the last focus area is the health impact of senior hunger. We know that seniors who may be experiencing chronic conditions such as cardiovascular disease or diabetes have specific nutritional needs, and that may cost them more. And so making sure that they have the resources to continue with the diets that help them to manage, prevent, and hopefully not cause their chronic conditions to get worse by providing the proper supports is a critical part of addressing senior hunger. So there's a lot more information that we need to get in this space, but this is why we're discussing it even today. The other part of the state plan is there are recommendations. The first, of course, was to hire someone in my position now, here I am, to actually work on the overall goal of addressing the Senior Hunger Initiative as a leading body. Developing regional coalitions, and I'll tell you about that momentarily, but the graph that you see there, or the map of Georgia, shows where those coalitions exist. And coincidentally, those mapped areas are also where the area agencies on aging map along in the state of Georgia. We've established a policy review council, which we specifically call the Senior Hunger Interagency Council, where we invite other state agencies who serve seniors with different services, whether talking about access to farmers, access to housing, access to SNAP. and bringing them to the table to say what services that you provide to seniors that we might need to tell the seniors that we serve, how might we share resources, share information, all for the betterment of addressing the needs of the seniors that we all serve. The next recommendation is about coordinating data collection and analysis. With all of these great state agencies working to address the needs of seniors, we don't always have the same system by which we're engaging with. And so making sure that, as an example, the Division of Aging Services, which works through and implementing the Older Americans Act, one big service that we provide are meals, whether it's home delivered meals or meals provided at a senior center. We want to make sure that we understand fully about what other food resources that these seniors engage with. Do they have SNAP? Do they have enough? What are some other ways that we can support that? And really understanding the makeup of the seniors that we serve. The next recommendation is developing and providing education and training. You even seeing this presentation today is part of that greater goal. We want people to know that senior hunger is an issue in Georgia and nationwide, but also saying not only now that you're aware, what is some training for us to be able to move the needle to address the needs of the seniors who are at risk of hunger? We've been able to continue and expand the What a Waste program. This program was brought to Georgia by the National Foundation to End Senior Hunger. And this is really critical for us to provide training to a select number of senior centers so that they can understand, what are ways that they can reduce food waste in their senior centers? How can they improve choice for their seniors and make sure that when they're giving food to their seniors, that they're actually consuming the food that they're eating. So this has really been a great program, and its max, we were able to get this to 36 sites across the state. And the last recommendation is providing entrepreneurial mini grants. Of course, this is ongoing. And of course, the state doesn't have all the funds to address the needs of seniors statewide, but with what we have, we want to be able to provide that funding out to the different regions. And by fostering, supporting partnerships across the state, we want to be able to bring in dollars, whether it's from foundations or other organizations, to really work together to make that happen. And so in my role as the Senior Hunger Coordinator, the main thing, of course, is helping in the implementation of Georgia State Plan to address senior hunger. Another part of that is planning and conducting Senior Hunger Initiative sessions at the annual ADRC, that's Aging and Disability Resource Connection Healthy Community Summit. So in the past, since 2016, we've actually had Senior Hunger Summits. And starting in 2022, we'll actually combine that. And so we'll have one summit, the ADRC Healthy Community Summit, and have sessions there about senior hunger. We're saving resources. We are targeting some of the same people who are interested in addressing the overall needs of a healthy aging community and those who want to address those who are at risk of hunger. And then outside of that, I help to assist in developing the Senior Hunger Coalition membership where needed. The other parts of that is providing any technical assistance, whether with the coalitions and their membership. And of course, I'll tell you more about that as I go forward. But also trying to develop and conduct meetings that allow for these different coalitions to engage with each other in sharing what works and what doesn't. And a great way for me to see as a state person about what's happening is to look at the annual reports that come from these different coalitions. We get to see what resources are out there, where the gaps in service delivery are, what are the innovative strategies that are taking place, and what is happening in really determining what would the regional strategy be to address senior hunger. And then another great responsibility of mine is making sure to support other initiatives that are taking place in the state. We know that we're not doing all the work. We know that the work to address senior hunger is going to be more than just the state looking at this. And so whatever initiatives that are happening out in the community with nonprofits, for-profits, universities, other government agencies, we want to be at the table talking about how we can collectively work together to address senior hunger. And then my last role is really serving as a subject matter expert, looking at the latest research, looking at what data is coming out, what data that we're generating. How can we share, when we share data across different agencies, what does that tell us about our seniors? Are the services that we're providing having the most impact in addressing senior hunger? And what can we do to move forward? And where possible, really supporting the opportunity for there to be regional engagement and discussion about senior hunger, and providing at least a point of direction of where to start to look for information. And also in turn, being a sounding board for where there's opportunity to bring funding dollars in, because the more we know about the seniors that we serve, the better we can provide access to services and get the funding to help with their various needs. So I've been talking about these senior hunger coalitions. So there's 12 of them. You can see they're named here, and they were all established in state fiscal year 2019. They have a very diverse set of stakeholders that are involved. They can be area agency on aging staff, they can be senior center staff, first responders, faith-based entity leaders. They are people who are in the for-profit space and the nonprofit space, all with a desire to address senior hunger. Some of them have legislators on them. It's really a diverse set of membership in these different coalitions. They meet a minimum of 3 times a year. In this time, that could be in person, that could be by phone, that could be virtually. A lot of things have opened up as far as opportunities for these different coalitions to engage with one another. Their key action items really are to say, what are the resources, gaps, and services that are duplicated in these different regions? How can we figure out what the best practices are and share that with the greater body? And also look at where one thing might work in this area may also work somewhere else. And maybe some things are very unique to a region, all for the purpose of understanding what does that regional strategy to address senior hunger look like. So I've given you a very quick overview of the work of senior hunger at the state level, specifically Department of Human Services, Division of Aging Services, but we know there's so much more going on. And so with this, we want to take this opportunity to share what we're doing and hopefully open the door, invite you to let us know what you're doing so that we can potentially work together, share information, and we're stronger when we're working together. If you would like to reach out to me, my email address is temitope.walker@dhs.ga.gov. It's there on the screen. I once again invite you to visit us on the web at aging.georgia.gov. You can specifically see the // to get involved in senior hunger. And of course, we are in all social media spaces under the banner of the Department of Human Services. That's Facebook, Twitter. And of course, once again, if you want to email the overall work for senior hunger, it's senior.hunger@dhs.ga.gov. Thank you for your time, and please, let's work together to address senior hunger in Georgia.
If you would like more information, contact Dr. Temitope Walker at senior.hunger@dhs.ga.gov.